My name's Yvette, and I live in Lone Tree, Colorado. I got a liver transplant in February 2013, and about 6 months after my liver transplant, I was having issues. I was feeling pretty run down. I had gone down to 100 pounds. I don't think I knew anybody that had symptoms as bad as I did.
I met Yvette about 8 years ago. She carried a diagnosis of primary sclerosing cholangitis. She had fluid buildup or ascites, she had encephalopathy or confusion, and so her quality of life was significantly impaired, and so we were delighted when we were able to offer her a transplant.
Most people get either Crohn's or ulcerative colitis, and then they'll get the liver disease. In my case, I got the liver disease, got the transplant, and then got the ulcerative colitis. So I had a bunch of questions.
You're telling me I've gone through this entire process of liver transplant, and now I have another disease to deal with. And so I was trying to help her understand what that meant and how it fit into her liver disease management and post-transplant management.
Dr. Fenimore is a really nice guy. He got me on a treatment plan that worked for probably a year or so. And then that one didn't work anymore, so he really worked to find a plan that would work even better.
I've been through a lot with Ms. Matthews thus far, and we've tried a number of different treatment options. As is often the case, the simple treatment options didn't quite work for her, and so we had to escalate therapy to a variety of different other medications. And she's kind of back to where she was before she met me, which is the ideal goal. So the Division of Gastroenterology at the University of Colorado comprises 3 different sections. Those sections are hepatology, which is focused on the management of liver disease and specifically transplant, luminal GI, which includes inflammatory bowel disease as well as general GI, and then our therapeutic group, which is mostly advanced endoscopy and specialized procedures.
The Division of Gastroenterology and Hepatology is comprised of many providers, nursing staff, researchers,
surgeons, the oncologists, the radiation therapists,
specialized colorectal surgeons, and IBD-focused nutritionists,
pathologists, radiologists.
Everyone who would be involved in the care of that patient.
And our objective is to advance the field of gastroenterology or GI and hepatology, which is a study of liver diseases. And at the same time, developing translational research programs that help us understand in a particular patient why they have a certain outcome.
The specific challenges that we face with inflammatory bowel disease patients is that they have often very significant disease that generates a lot of symptoms, and it's a chronic illness. So these patients are told that they have something they're going to live with for the rest of their life, and then trying to figure out a treatment plan that's going to give them the best quality of life that they can achieve over the long term.
One of the most important things we do is take time to listen to the patient and understand what their concerns are and do our very best to address them and hopefully alleviate suffering that they're having.
Here at the University of Colorado Hospital, we have a digestive health center, which really allows us to support all of the clinical areas in gastroenterology. It encompasses not only the interventional section, which I'm most closely aligned with, that includes everything from hepatology to inflammatory bowel disease to esophageal disorders, and even things like irritable bowel syndrome and common gastrointestinal disorders.
The whole team at the gastro clinic is, they're very nice. The receptionist knows me when she sees me. It's not something I don't look forward to.
In the past, a patient's experience was somewhat disjointed, and so they would be seen 1 week by a subspecialist in our field, and weeks, sometimes months later, by another specialist. And I think now we try to streamline the experience, make it easier for the patient.
We have patients seen quickly by multiple different providers who approach a problem from a different perspective and add to our ability to address it successfully.
It really enhances our care of patients because you get the opinion of multiple people who are telling you either, yeah, I think what you're proposing here makes sense, or no, have you considered this? There's something else that may be a better treatment option that you may not have considered.
It essentially gives the patient 20 or 30 opinions about what's available for their care, and then we try to hone that down to one dedicated plan for the patient.
Being on the Anschutz campus provides access to a variety of specialists who are physically close to one another. That includes clinicians, but also research scientists. So we have a very vibrant, collaborative approach to taking care of patients. I think we answer a lot of difficult questions and can really see the beneficial outcomes for our patients. It's also fun and exciting. We are at the vanguard of discovery. We're finding new ways to take care of patients. It shows that we're achieving better outcomes than we thought were possible.
We're very invested in fellowship training. It's our lifeline in terms of why we're here in academics versus being in private practice. It's the opportunity and really the privilege to train fellows and make them the best consultants they can be.
It's a really competitive program that focuses a lot on excellence in clinical care in GI, as well as fostering a research program early on for our fellow trainees to shepherd them into junior facultyhood.
We want to be the first to incorporate many of the new technologies that are available, but we also want to develop our own ways of taking care of patients and really making their lives better.
Patients come here and get answers, and I think that's what you want as a patient, is you want clarity on your prognosis. It may not be the prognosis that you wanted, but at least you leave with an understanding of what your prognosis is, and that everything that can be done will be done.
Well, when I first came to see Dr. Fenimore in the GI clinic, I was feeling pretty bad. I was pretty run down. It's been 3 years now that I've been going to the clinic. And now it's mostly pretty routine, sort of a check just to make sure that things are okay. So the future's bright.
Yvette's just a wonderful person. She always wants to hug me, hug the nurses. She's grateful for every day. She's the miracle of transplant. I think why we get into liver transplantation, because you can see a patient who's so gravely ill get a new lease on life and really rebound back and become who they were meant to be all along.